Support for Radio Friends comes from Le Brunnery Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact Le Brunnery Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on Monday, April the 25th. I want to introduce you to a doctor who hasn't been with us for just a little bit, but good to have her back, Dr. Smrita Dorairajan.
It's wonderful. A very good morning to all our viewers. Always a pleasure to be back, Paul.
Yes, it's good to have you. We're going to talk about chronic kidney disease, and you are a doctor at the VA hospital. You specialize in kidney disease. How many people in our country are affected by bad kidneys?
So chronic kidney disease, the magnitude of the problem is huge. 37 million Americans, which is 1 in 7, making 15% of the adult American population have chronic kidney disease.
1 in 7 people?
Yes.
What is considered chronic kidney disease?
So when you have kidney trouble, which is persistent for greater than 3 months, then it is called chronic kidney disease.
And how do you know if you have kidney problems?
So the worst thing about this is the kidneys don't have symptoms sometimes till you get down to very low level of functioning. So about 40% of people with chronic kidney disease don't even know that they have this issue. And it is picked up when they go to a primary care physician and have routine blood test or urine tests. That's when it's picked up and then they are referred to us.
So it'll be picked up when you have blood tests?
Yes.
Is it a specific type of blood test that you have to request, or will it just show up when you have diabetes or cholesterol blood tests?
It's a basic metabolic panel. So this is what primary care physicians order all the time when you go to see them. So this is a muscle protein called creatinine, which is excreted by the kidneys. And this is what they measure. And in the urine, too, they can pick up with like protein in the urine. Uh-huh. You're not supposed to have any protein. But even if there are traces of protein in the urine, then you better see a kidney specialist.
Okay, but let me just clarify. If you've gone to your primary physician and you've had your blood test, if they're just checking for cholesterol and diabetes, they have run that test for your kidneys.
Most diabetics get this basic metabolic panel.
Okay, so if you didn't hear anything negative from your doctor, then you should be okay.
Yes.
Is that the only way, besides the blood test and the urine test, that you can diagnose that you have kidney disease before some terrible symptoms show up?
Yes. Unfortunately, you don't have too many symptoms. Some people may have increased urination or frequency of urination. Some people may have elevated blood pressure, which manifests early on. But majority of the times, it's by the blood and the urine test. So that's why screening high-risk populations is very important.
That last statement was?
2/3 of chronic kidney disease is caused by diabetes mellitus and high blood pressure.
So if you have chronic kidney disease, how is it treated?
So there is no separate treatment for the chronic kidney disease. It's addressing the basics again, getting your blood pressure under very good control and your diabetes under very good control.
Why does high blood pressure affect the kidneys?
So when you have high blood pressure, it affects the filtering units in the kidney. So they get damaged over time and the number of filtering units go down. So that is how it affects the kidneys. Similarly with the diabetics too. Diabetics can have changes in their eyes from all those small vessel disease. So the filtering units of the kidney are also made up of small vessels. So it causes sclerosis or damage of these filtering units.
But what you're saying is if you have chronic kidney disease, there is no treatment for that disease of the kidneys. You have to get the other factors under control. Will the kidneys then heal themselves if you get your blood pressure under control and you take care of your diabetes? Are the kidneys going to heal themselves?
Yes. So in the earlier stages of the disease, if you address the high blood pressure, the diabetes, if you're a smoker, give up smoking, and if you're obese or overweight, getting your body under the ideal body weight, all these factors are going to help you to prevent further progression of the kidney disease. And if caught early on, maybe to gain some kidney function back too.
What does it mean when someone is diagnosed with kidney disease and say they're in stage 2 or stage 3 or stage 4? What do those stages mean?
So we go by like a glomerular filtration rate, which is a formula based on your creatinine and your body weight and all that. And when that percent is above 90%, it's stage 1. Above 60% is stage 2. Above 30% is stage 3. And above 15% is stage 4. So as the stage gets worse, the severity of the kidney disease gets worse. So when you're below 15% is when you're talking about dialysis and or a kidney transplant, things like that.
Is that in stage 4?
Stage 5.
Stage 5
yes.
is when you would need to talk about dialysis.
Or a transplantation, whatever may be suitable for you based on what the kidney doctor...
So what do you do if you're in stage 4?
So stage 4, stage 3, stage 2, all these stages, you can try to keep the same kidney function moving forward by addressing all these host of factors that we spoke about. And now there are some group of medications which can also help you to prevent this proteinuria in the urine and also to keep the same kidney function and prevent progression.
Okay.
But the basic is addressing the high blood pressure, the diabetes, and the lifestyle issues that contribute to this kidney disease, and with the help of some medications.
Okay. All right. So it's important when you go in for your annual wellness or physical exam, when they do that blood test, it will also check for your kidney functions.
Yes.
Okay.
So it is very important for high-risk population like hypertensives, diabetics, African American population, people who are obese and age over 65 years. It's very important to get that urine test and the blood test.
Okay. So the blood test isn't enough? You need to get the urine test too?
It's good to check the urine too, because the urine, protein in the urine is one of the early indicators of the kidneys getting affected.
Okay. Doctor, thank you so much for coming by. Dr. Smrita from the VA hospital, we appreciate it. And people could call there for more information.
Thank you so much for having me.
Please come back again. Okay?
Of course.
Very knowledgeable. Bye-bye.